Hi. So today we'll be discussing your birth plan. So what is a birth plan? A birth plan is basically a list of your preferences to make your birthing experience more pleasant. It's important that this birth plan is taken after a lot of consideration, a lot of research, and a lot of thought. And I hope this capsule will help you make a better birth plan. It's important for you to remember that your birth plan is more like a guideline, and you need to be pretty flexible. So keeping the safety of your baby and yourself in mind, sometimes your doctor may have to make changes on the fly to your birth plan. And that's why I would like you to be flexible. But if your doctor is aware of your preferences, it would help us, guide us to give you a better and a more satisfying birthing experience. Now this birth plan needs to be done and dusted by your 8th month. Discussed and a copy given to your doctor, at least make all the points clear. Definitely not something to be discussed in your labor room when you're in labor. So let's discuss all these aspects one by one. So the first aspect is, which hospital would you be delivering in? What type of accommodation rooms you'll be looking at, whether a single room or a suite room or something like that. And you'd also need to know whether you need to do any booking. And if you have any insurance coverage, you'll have to make sure that your insurance cover matches that room which you have booked. If not, then you'll have to make adjustments to the room, or you'll have to make adjustments to your budget. But these are all best done well in advance. You would also have to give consideration to your labor room or the delivery area. Now we have various formats. One format is where you labor in one area, and then at delivery you'll be shifted into what is known as a delivery room. Now this is typically seen in busy hospitals, and it allows the hospital to cater to a large number of people at one time. The disadvantage of this is it doesn't give you that amount of privacy, and also it involves shifting you from one place to another when you're in pain. So another concept is what is known as an LDR concept. In an LDR concept, you would be laboring, delivering, and recovering in the same room. And after you have been recovered, you'll be shifted to your accommodation or your residential quarters. An extension of this LDR concept is what is known as an LDRP concept, wherein which you labor, deliver, and recover in the same room, but that same room is then converted into your accommodation room and what is known as a postnatal room, therefore LDRP. Now all hospitals may not have all of these facilities, so make sure that you know what you're getting into when you select your hospital. In some countries, they allow you to deliver at home. In my country, India, we do not recommend you deliver at home. We would prefer you come to a hospital. But if you have that option to deliver at home, make sure that your healthcare giver is aware of your plan. You'd also need to know whether you would like a partner with you or a companion with you during your labor and delivery process. You need to decide whether you'd like your partner with you throughout the labor process, or only during the labor process, or only during the delivery process. Would you like your partner to be with you even if there's an instrumental delivery or a cesarean section? So make sure that you're very clear about what you would like well in advance of you actually getting into labor. And make sure that your partner also is comfortable with being with you throughout this process. You could also decide things like lighting in the room. Would you like your room to be bright or dimly lit? You could also decide on whether you would like music in your room, and if so, what type of music. Many labor rooms have got TVs in them. You would like to know whether you would like a television on, and if so, what would you like to watch. Or you could decide on a book, and therefore you need to decide on what book you would need to read as well. So all these things are best thought about and put in your birth plan. Now there are some what we call as specialized birthing equipment. Stuff like birthing mats, bean bags, some various type of birthing balls. So make sure that you're well trained in using them in your antenatal period, and your healthcare giver is aware of your preferences, and make sure that your hospital where you are delivering actually are okay with these equipment, and if they do not have them, are they okay with you bringing them yourself. So now we'll come to the monitoring in labor. Now the safest way to monitor you during labor is to put you on a monitor where we monitor your baby's heart rate right through your labor and also your uterine contractions. So this gives us a lot of safety. But it also means that you'll be tied down to the monitors, even though nowadays we get some monitors which are wireless. Nevertheless, some ladies don't like to be put on with too many monitors. So you would need to decide whether you would like this continuous monitoring or would you like to be monitored intermittently. Now I will be taking up a capsule on this subject of intermittent monitoring versus continuous monitoring and its relationship to the cesarean rate in a future capsule. You can also decide about your position and activity in the labor room. There are various positions available which you can do some research on, whether you would like to lie down, whether you would like to walk around, whether you would like to sit in any particular position. So you can look at all these positions and you can talk to your partner whether they can assist you in those positions and maybe practice as well. As soon as your baby is delivered, we'll be doing three things. One is we'll be clamping and cutting the cord. The second thing will be giving the baby to breastfeed. And the third thing, we would like to encourage skin to skin contact. So we'll look at all these three one by one. Coming to clamping of the cord, there is a concept known as delayed cord clamping. Now I request you to look at that capsule which I have. I'll have the link somewhere up here, wherein which we would not clamp the cord as soon as your baby is delivered. We allow the baby to be delivered and we would allow around 100 ml of that beautiful, wonderful blood which is there in the placenta to come to the baby. We cut the cord maybe a minute to up to 3 minutes after the baby has been delivered. During this time we'll be cleaning the baby up and making sure baby is doing well. But this blood which is there in the placenta contains a lot of good stuff which would be helpful for your baby. Now you must be aware that many hospitals do promote something what is known as a cord blood banking. Now in this concept, the cord is cut immediately and the blood which is in the placenta is then collected in blood bags and transported to a laboratory. There they remove the stem cells and store it, and they claim that the stem cells could be used for your baby in the future or some other babies in the future if the need arises. Now most of us doctors believe that barring some rare genetic issues, the vast majority of deliveries, our babies would benefit more from delayed cord clamping rather than storing the cord blood for some imaginary or rarely used situations. But nevertheless, it's something you need to discuss with your doctor. The other aspect is skin to skin contact. Now we prefer that as soon as a baby is delivered, you need to be in close contact with your baby, and a skin to skin contact really helps the emotional bonding as well as breastfeeding. Now this skin to skin contact can be done even before we've actually even cut the cord. It's important, of course, that for both delayed cord clamping as well as for skin to skin contact, that the labor room, the delivery area where you're in, the temperature is well monitored because we can't have the room too cold. The third aspect is what I discussed was breastfeeding. We know that if we put the baby to breast within a half an hour of its delivery, the breast milk production is very good, and also the baby does very well by it learns to latch on quickly. So if the baby is perfectly well and you are perfectly well, I would any day prefer my babies to be put to breast as soon as I can. So make sure you discuss this with your caregiver and include it in your birth plan that you would like your baby to put to breast within a half an hour of delivery. So if you're delivering in a teaching hospital, you may be aware that often you would have trainee nurses as well as trainee doctors witnessing and learning from your delivery. You would need to decide whether you're okay with that. And if you're not, then you'll have to document it in your birth plan, and if you are comfortable, document that too. An important aspect of labor is pain relief. There are various methods. Methods like epidural analgesia, pethidine, which is an injection, Entonox or nitrous oxide with oxygen, which is a gas. We have acupuncture, something called as TENS, various relaxation methodologies, which will help you decrease the amount of pain you feel during your labor. I would suggest you read up about them, discuss it with your doctor, and put it in your birth plan. Like I said, I will be discussing this in a future capsule. You will need to discuss about the episiotomy. Now, an episiotomy is a small cut given on the perineum to help our baby come out easier without tearing your perineum. Now, you have a choice there whether you would like your doctor to give an episiotomy routinely or only if it's absolutely necessary or not at all. Now, you need to discuss with your doctor very clearly about the pros and cons of your decision and get it in your birth plan. So this is an outline of what a basic birth plan needs to be. So please do like these capsules and please do subscribe if you have not yet. And more importantly, please do share these capsules with your friends, with your relations, because I know there are a lot of women whose doctors don't have the time to discuss all these elements, and these capsules will help them. Alright, so I'll be seeing you soon. Bye.